Hello, peoples. It's his little Cherie. Thank you for journeying with me to a better brain. I have been reading this book, The End of Alzheimer's Program. I'm on chapter 2, which I will give you a summary of momentarily. There's a lot of information in this chapter, so this will be a summary. And if you remember in chapter 1, the book talks about a genetic marker called APP, which is the switch that if you have it, it increases your risk for Alzheimer's, because if you have factors or contributors that will flip that switch on, then you may develop Alzheimer's. There are several types of Alzheimer's depending on what's contributing to the disease, the factors that contribute to it. So they call the first type of Alzheimer's inflammatory or hot. And that means that you have ongoing inflammation, and that can increase your risk for Alzheimer's. The second type is called atrophic, or cold, meaning you have suboptimal levels of nutrients, hormones, or growth factors. I'm just glancing over at my notes. The third kind is actually a combination of the first two, and it's called glycotoxic or sweet, meaning you have high blood sugar or high fasting insulin. The next kind is called toxic or vile, and that means you have exposure to toxins that increase your risk. The next kind is called vascular or pale, meaning you have cardiovascular disease. And finally, there's a type called traumatic or dazed. No comment. And that means you have a history of head trauma. Well, I don't have a history of head trauma, but I do feel dazed a lot of the time. So all of those things can contribute to or increase your risk for Alzheimer's. And because there's so many things that increase your risk, the book says that virtually all of us are at some risk for Alzheimer's, which isn't good news. But the good news is that there is a treatment now that they better understand all of these things that can contribute to Alzheimer's. And the treatment can be summarized as removal, resilience, and rebuilding. So removal of exposures that contribute to cognitive decline, resilience resulting from building optimal health support, and the rebuilding of the neural network. So here's how you do those three things according to chapter 2 of this book. First of all, you have to address insulin resistance, or in other words, you need to become insulin sensitive. The second thing is to get into ketosis. The third thing is to optimize all nutrient, hormones, and growth factor support. Number 4, resolve and prevent inflammation. Number 5, treat chronic pathogens. Number 6, identify and remove toxins. And number 7, rule out sleep apnea and optimize sleep. So that is a broad summary of this chapter, which has a lot of information in it, a lot of detail that I could not include in this summary. But the rest of the book goes into more detail about all of these things. So we'll learn in the next chapter what to do next, which is the good news. There's something that we can do to help reduce our risk of this terrible disease. Okay, thanks for journeying with me. I'll be back sooner rather than later, I hope, depending on how dazed I feel. Love you.